we are also trending towards a capitated system of healthcare where either a certain facility has a certain area of service or where a certain procedure is covered at a certain dollar amount, regardless of the length of stay. So healthcare systems have a vested interest in using technology that speeds up the recovery.
Welcome back, everybody, to another episode of Wellness at the Speed of Light. I am so excited today to have Professor Paolo Cassano, MD, PhD from Harvard University, an assistant professor in the psychiatry department, the director of the Photobiomodulation division of Massachusetts General Hospital. With us today, I've been looking forward so much to our conversation, as Dr. Cassano is really a pioneer and leader in the space of photobiomodulation, is doing great things, is well published, and has a wonderful way of speaking and being able to try to simplify the concept of photobiomodulation, which is so misunderstood, not just in the lay community, but also in the medical community writ large. And I think it is the future of medicine, or at least one part of it. I'm so excited to have him on the show today. So welcome, Dr. Cassano, to our program. And just want to thank you for taking some time on this Sunday morning to be with us.
Thank you so much, Stefano, and it's delighted to be here. And maybe we'll have a chance to speak Italian at some point in the talk.
Buongiorno.
There you go.
There you go. So I'm going to start with a really broad question. Okay, a lot of your now you're a professor of psychiatry, but a lot of your focus has really been in the photobiomodulation space. You are tremendously well published. Your works are excellent. You have a lot of research studies going on. Why the major interest in photobiomodulation?
So it was a little bit haphazard, I have to say. It's not that I said, oh, this really looks cool and I'm going just to throw myself into it. In fact, as a matter of fact, if anything, I didn't want to do it. So for full disclosure, and little by little, then I kind of fell in love with it. So this goes back to pretty much when I had done my residency program at MGH McLean, and I was done in 2009. And I was clear that my interest was in international psychiatry. That kind of was an old passion of mine, international work. I had done some travel during the residency in Belize. I'd done some work there. And before that, I had studied some infectious diseases before getting into psychiatry. So there's always this interest in cross-cultural, international psychiatry. So I was going to work in the community. And in fact, I work as a community psychiatrist with different immigrant population in the suburbs of Boston for about 10 years. And it was clear that my patients didn't like at all what I had to offer. The idea of medication equated with the poisoning. There was a question of infertility that used to come up. If you went into side effects, it was even worse. So I thought, okay, well, light might be interesting. Maybe it's something else, and maybe it will be received differently. So that's how it all came about.
That's very interesting. As we chatted just before, I kind of just came across, photobiomodulation, laser therapy, some of the stuff that I've become so passionate about. It actually happened when my son was injured, and I met a gentleman who was, very much into the science of photobiomodulation and thought it was the greatest thing ever. It took him about 6 months to convince me to even look at the research articles, because as a classically trained physician, I just said, how can light do that much, and why don't I know about it? Nobody taught me this in medical school, so it can't be true. But once I actually opened my mind and started combing over the research studies on photobiomodulation, I mean, it opened up an entire new world for me, and the potential and possibilities are so dramatic. And I just want to get this message across, and that's why I'm so excited to have you on the program today, because you're really leading the charge. And having, somebody like yourself, an honor for me to be able to pick your brain on everything photobiomodulation. I think for the group that is going to be watching this and listening, I think we need to start from square one and talk about what is photobiomodulation and why is it such an exciting new field in our, medical world?
Absolutely. Before we get into that, I wanted to say, first of all, I'm sorry about your son, and I hope things are okay.
Yeah, he's fine. He's fine. Just a broken leg, and so we were just looking for different treatment options. Thank you. That was a couple of years ago.
Okay. And second, I wanted to comment on leading the charge because I think academia plays an important role. However, there's industry and there's a wealth of knowledge in industry. And then there are people like you that are doing the clinical work, the practice every day, that have incredible knowledge from seeing one patient after the other and really understand the nuances of the treatment. And then there is family and patients. And I see this really as the four legs of a table. You take one out of the equation and the table is wobbly. So it's really all together that we can make a difference. And so that's why this is great. The fact that you're reaching out, the fact that there is this communication. And, if any of your patients are willing to come into the show, I think that's also going to be very powerful. So in terms of your questions about what is photobiomodulation, it's really in the word. Photo stands for light, bio, living tissue. So what we're doing, we're modulating the function, and sometimes also there's this word in science, trophism. We are modulating even the growth of the living tissues. And so the light, what it does is, at the very least, it modulates, and for the brain, if you wish, it paces brain function. It also can help the communication of different areas of the brain. We call that connectivity. And at most, it can energize the brain, increase brain energy in the cells, and potentially rejuvenate.
Well, so as far as the mechanisms, and we're going to go a little bit deeper, as I just want to get a couple things clarified for the audience before. What's the major mechanism of effect of photobiomodulation? In other words, what is the light actually targeting?
Yes, so we can talk about that. I will just also put a kind of a disclaimer right there that the light does many things to living tissues. And it's a very fundamental interaction. In the scientific community, people are still trying to wrap around their head in terms of understanding what is the primary effect there that is so meaningful. So I can tell you, first of all, what is the theory for a long time, and I can tell you that it has been proven. So the light does something very similar to humans and to animals as it does for the plants. So there is an energy transfer from the photon to the cell. So the energy of the photon leads to energy in the cells through energized molecules that are called ATP. And it's a photosynthetic reaction. There is an enzyme in the mitochondria, which are the powerhouse of the cell. It absorbs the light. Then there is the energy transfer, and then this energy is now available to the cell. So that's been demonstrated in cell cultures, has been demonstrated in animal models, and has been demonstrated in humans. There is a technology called MRS, or magnetic resonance spectroscopy, that allows you to see where these high energy molecules get formed. And in fact, there are two groups independently, one in Metropolitan Manchester University in UK and one at City University of New York. Both have demonstrated that if you shed high power energy and also not so high power energy to the brain, you can increase the energy of the brain or metabolism.
I mean, I think that's a great answer. That enzyme we're talking about is the cytochrome C, oxidase, all that whole pathway, without getting into all the different complexes on the mitochondrial wall. Again, that's beyond some of what, the audience knows, but it's just, that is what, it's funny because I talk about photobiomodulation all the time, probably too much to the, people kind of start walking away. They're like, oh, here we go again with all this light talk. But
do you find yourself talking about it at dinner, social events?
Everywhere. Why? How can, what else is there? I mean, there's all the word. So it's funny. I've said
It's
it
a common problem.
Yeah, it's a problem. You're a psychiatrist. Maybe you can help me with all this stuff.
I have the same problem, so I'm not sure I can be much of help.
So the word mitochondria is almost banned in my house. My wife wants me to, and I've talked about that, on previous episodes. But what the exciting thing is, as a physician, I don't do like science bench work, but I am a scientist, as a physician. And the exciting thing is, and I don't understand how other people are not, downright giddy about it, is if you shine the right wavelength on cells in petri dishes, they do different things. You literally are changing them, right? Fibroblasts start to dance around and they become more active, and you can see them. That's why it's so effective in wound healing. You can just see it, like you said, and with these different imaging techniques, you see the changes, and it's been proven. And so when we talk about photobiomodulation and its effect on cells, human cells, and then eventually on the human organism, it is rock solid science. So I want to get that out here. This isn't something where we're having a conversation and we're saying, hey, imagine if this actually ends up working, or these theories are proven in many, many different ways. Now, are all the mechanisms elucidated? No, but a lot of the main, mechanisms are elucidated. One of the things that really, really fascinated me when I did a deep dive into concussion work, some of which has come out of your, great institution and things you guys are doing, is the fact that it is, if you go down to the cellular and then even further down to the mitochondrial level, so much of concussion now can maybe be understood as a mitochondrial dysfunction because of the injury that happens across mitochondria, right? And there's such a huge density of mitochondria in neurons, and so they're particularly potentially susceptible. So a lot of the work that's being done targeting the brain makes so much sense, and we're going to get into some of that more deeply, because it is fascinating what you guys are doing and looking at in terms of brain health. Before we start talking about a couple things, I want to get out there before we start getting into brain health and all the great work that's being done. One is the fact that now that we've established that this is hardcore science. I actually had Scott Sigman, who is right down the road from you guys, the founder of Ortho Laser, on the program. Now that episode actually airs next week, and people will see the snippets on that. But it's the same thing. One of the things we got into is, again, he's a big believer in PBM, and we talked about how proven the science is. But one of the things I want to get to is, why is it so difficult for our colleagues, and then going, and then pervading from there into the general public, why is it so difficult for people to wrap their minds around how powerful light can be? And why is there so much skepticism over the light, where you just beautifully articulated how much science there is behind this? This is no longer a question, it's a fact.
You and I have talked about this briefly, and I think there are some reasons out there that are fairly obvious. This is not part of our training as physicians. That's one of the basics, really, up there. Also, it's true that the industry that has been promoting certain interventions is not as powerful in the sector sector of light therapies. So there is less information that is boosted by the industry. So those two are certainly factors that are, undeniable. However, I want to play the advocate of the devil here. And, the reality is that when I meet a patient, I tell them, yes, we have seen promise, and yet the level of evidence for many of the applications related to brain disorders has not yet reached the level to get to FDA approval. And so we as clinicians have seen it. However, in the science, we haven't provided the numbers and yet the rigorous trials to convince the FDA. We haven't met that bar yet. In all fairness, I guess our colleagues have some reasons to say, well, show me, prove me. And also, there is, fortunately, in our litigious society, there's always a concern of saying, well, if I do offer a treatment that is not FDA approved, what risks am I taking? And although this is an extremely safe intervention, there is always that concern for a clinician. So in fact, people like you and I are taking a risk in the spirit of serving people that we know are not getting their needs met.
I think that is beautifully said. I think that one of the things absolutely the safety profile of, for example, if you're using like a class 1 device, the helmet therapies and things like that, there's no question. And the FDA's in their own statement, as far as PBM, it's almost an insignificant kind of risk. That is exactly the statement. And so, photobiomodulation is FDA approved for musculoskeletal, soft tissue pain, that kind of stuff. And so we use that a lot, obviously, in our clinics. For the brain work, it's going to take a lot more randomized controlled studies like you guys did at Harvard on the concussion study that was released in 2021, which clearly showed a significant improvement between the PBM group and the non-PBM group. But more of that stuff. Do you think that because there has been a lack of industry funding for these studies, it's one of the things that has held back research? Because it is, if you think about it, just shining a light on somebody's head for this it's such a simple thing to do. And honestly, if there were the research dollars, you can do it on a massive scale so easily, as opposed to, for example, doing deep brain stimulator research, where you have to, put something in somebody's brain. It's such an easy thing to do. It's almost as easy as saying, hey, wear this patch for a week and we're going to do a study on it. So it's almost that we just need more funding from industry and from institutions.
I'm with you. It's safe, non-invasive, even pleasant for most of the people, this gentle warming. And some people feel some level of benefit right away. For some people, it takes weeks or multiple treatments, but it is a non-significant risk. And the FDA has been very clear about it. And in fact, some of these treatments are available over the counter. Some of the treatments are more require more handling in office for sure. It's clear the NIMH, the National Institute of Mental Health, wouldn't fund large clinical trials to demonstrate efficacy or safety. That's clearly stated. Their agenda is to look at the effect on target engagement. So can you modify a certain dimension of brain function, whether it's blood flow or energy metabolism, you name it, to connectivity, and can you show that that is dose dependent? And is that dimension relevant to that disease, to the outcomes that you are hoping to see? And their rationale is that if you see a dimensional effect and you establish that that dimension is predictive of some beneficial outcomes, then you open a door to many other interventions that follow the same path. They don't want to do the big pharma trials, so they say someone else has to do it. And then now in the light therapy treatment, there's no big pharma. And so those trials are taking some time.
It's frustrating. I had actually my second episode of the podcast, I had my partner, Dr. Eric Nussbaum. He is just a world-renowned neurosurgeon. He does these brain bypasses. He does things that nobody does, frankly. A few surgeons in the world do some of this stuff. And in preparing for that one, I just spend so much time on things like concussion, because he is very, very interested in things like photobiomodulation. He's very pro transcranial photobiomodulation. He's very interested that a neurosurgeon of his caliber, he's on the bandwagon. He's like, it's a no-brainer compared to some of the invasive things that are offered, for example, in the neurosurgical field for some disorders like Parkinson's and so on. Now, when I did that study, we ended up getting into a dive on concussion, which I'm very passionate about. And one of the things, again, that's held back concussion is a lack of funding for major studies on some of these, what are considered, complementary, medicine. And I think that using words like alternative and complementary medicine automatically gives things, automatically puts it in the bucket of, oh, that doesn't work. That's just voodoo medicine. And it couldn't, be the opposite of it. So there are so many things that we haven't progressed. And think about how slow the progression in concussion management has been over the last 40 years. A lot of that is because we haven't done massive, clinical trials that are non-pharma driven on it. We're just trying to come up with some magic pill or some procedure that helps people with concussion, but not things like light therapy and other things that don't involve, procedural uses. So back to the excitement of, studying this stuff. How did Harvard become such a pioneering institution in this particular field? How did that all come about? What is sort of some of the history behind that, and how they've become the leaders in photobiomodulation?
Yes, I'll get to that. I just wanted to comment on what you said because it's interesting. I will say that I'm quite hopeful, and I am hopeful because I see that this is coming as a bottom up, and patients are desperate, and there is a need that is totally unmet, which is related to any cognitive disorders, whether it's concussion, of course, chronic TBI, CTE, Alzheimer's, myocardial impairment. So far, the effect of existing intervention has been, at the very least, limited. And so people are desperate, and we know our population is aging. This is a growing problem, and we have a solution. It's just about time, and I would give it a couple of years that this is going to be massive. And also trials are being conducted, and some are in US, some are abroad. So there's the scientific community is producing an exponential growth of scientific work on this. So it's true that the providers have not adopted this, but all around, everything else is conjuring to bring this treatment forward. So that's what makes me hopeful.
One thing before I get that, sorry to cut you off, but one of the things, just going back to something that you said before about, not having a lot of these major clinical studies. One of the things that I want to get out there, and I know you see this, is in the actual patients that are sometimes very desperate for help. Now, we've seen this in post-COVID brain fog, some people we've treated at our wellness clinic, in concussion patients who have sought care, major institutions, and then they're coming to our small clinic, right? And they are at their wits' end. They have seen sometimes world-class people, right, to try to help them with their care. And they've done all kinds of rehabilitation, vestibular retraining, all these things for concussion, but yet they're very frustrated. And then we tell them right off the bat, our treatments, they're not FDA approved, even though light therapy has low risk. However, here are the studies, and we can point them to what we feel are very, very strong studies. So far in TBI, my big one is the 2021 study out of Harvard, obviously is the one that I really always point to now because it's randomized controlled. But what I want to get out is we're seeing it on a clinical level where patients go from absolutely a mess, right? They come in some of them can hardly drive because of their concussion. Their lives are ruined. They can't think, they can't do anything. Now, we have a couple, in our clinic. And again, this becomes anecdotal, and that's the problem. But when something is anecdotal, but it is dramatic to a level that even as physicians, we're almost shocked. I've seen patients that have concussion go from barely functional to almost normal over a couple months period of time. It is fascinating to see. I have never seen anything like it. Again, concussion is not a space that I was, big into until a couple years ago. But seeing that absolutely makes me think that once the studies are done with the right dosing and that's something we're going to get into in a little bit. But once we get the right kind of protocols and we utilize AI and we can individualize and personalize the treatments, just from what we're seeing from more broad protocols where everyone is learning from each other on what works and kind of what is not working. And so we had the privilege of people that came before us. So we're using other people's protocols. And we're seeing these dramatic differences. Again, once the studies show it out, I agree with you, it's going to be an explosive adoption of using light therapy because of how safe it is and how powerful it can be. The one thing I will caution, and the one thing that bothers me, her name is Valerie, and she works for one of the photobiomodulation companies that we use for a product. Now, she was doing PBM on patients. She was using laser treatments for things, and actually also doing like early brain work 15 years ago. Like way, way, way long time ago. So her things, she started clinically in Florida and then became basically a salesperson selling this stuff because she believes in it. I had a conversation with her, and honestly, she was almost on the verge of like tears because she said that many, many years ago, she was 100% positive that within 5 years, photobiomodulation was going to be the thing in medicine everywhere, the future of medicine, because of what she saw like on the ground. And here we are in 2024, and she's in a complete state of shock. I have to get her on the show actually, because I want her to tell the story. Cannot believe how little penetration there has been in PBM in the medical community, still at shock. So yes, I share your excitement 100%. And we could just kind of throw a party right now. We're so excited, it's going to be great. But people have been talking about this now for quite some time, and PBM's been around for quite some time, right? It's pretty well studied, but yet here we are. We could tie it back now to how Harvard became, involved in this whole thing, or whatever other thoughts you'd like to share, because I see you getting excited there.
I'm making your job more complicated here because I have another digression. But, you give me ideas. That's the problem. So I'll blame you on this. So on that note, Neil Finson in 1903 got the Nobel Prize for finding that the light was dramatic in treatment of wound healing. And here we are, it's more than a century, and this is not adopted. And I'll tell you more, that these days in the United States, in North Carolina, in other states, there are people that are using this light to treat people that are deemed incurable from top institutions that are discharged from the hospital with terrible wounds on the verge of becoming septic. And over 3 months, of laser therapy. And so I'm holding this dialectic. On one hand, I think this is going to happen. And, I go from there to the other hand to say, well, yes, but it didn't happen for skin, and it's so obvious. And so I hear you. I am in the same dialectic.
Talk about treating other conditions. Now we can go down the whole chronic diseases and how so much of it is based on mitochondrial dysfunction, which why it makes sense that phototherapy works for all these different conditions. Other conditions that are seeing some significant benefit. Again, I mentioned post-COVID. Lyme's disease patients, it is a classic group of people that seek care, right? They go to these forums, they talk to each other, they get every book. There's so many published authors that just want to talk about their struggle with Lyme's disease and how they tried to get over it. There is good evidence in these kind of post-infectious models that phototherapy can make a significant difference. And I can say I've seen firsthand Lyme's disease patients make significant improvements in their symptoms after weeks. And sometimes they require months, but major differences. But yet you ask the average infectious disease specialist out there, and I do it all the time, and I pick their brains. I mean, again, this is another group that kind of runs away when they see me in the halls at the hospital. But again, for these post-infectious patients that are so desperate for treatment, why do we not at least try something that is such low risk with these patients to try to improve their symptoms when they're miserable for such a long period of time? Again, wound healing. I just talked to a foot and ankle guy who is in California, who is a huge proponent of utilizing photobiomodulation for wound healing, and he also uses it for neuropathic pain, another area where we've seen tremendous differences. And he is beyond shocked that his foot and ankle colleagues are not recommending laser treatment, number one, to decrease pain, just post-operative pain, but to treat, right, all of these neuropathic conditions, which are so prevalent in the foot. But there's a no-brainer to treat these open ulcerations and diabetes and non-healing wounds for whatever reason, and lymphedema and all these other chronic conditions. And so again, we could go on. I mean, I could give you example after example of conditions or doctors I've talked to where the ones that are pro PBM, where there's so much shock in our little community that is growing pretty rapidly, actually, in the use of PBM, of how underpenetrated it is. And I'm sure you see this in the neurology community and the psychiatry community, where they're not aware of some of the amazing work that you guys are doing on this front. And it's got to be a source of frustration because it can be so dramatic, the effects of these things.
Some thoughts here. First of all, kind of a little bit of self-disclosure here. I'm going to a major institution these days for kind of a rotator cuff issue. And I did ask them, I'm going to tell you, I'm not going to name names. It's a major institution in Boston in the Harvard system. And all what they do is rehabilitation, cognitive to physical, all they do. Use infrared, red light. They know what it is. The answer is, no, we don't use it. Why you don't use it, I don't know. I think probably it has also something to do with reimbursement. So if you don't have FDA approval, you don't have insurance reimbursing, and that makes all more difficult. And the medical system is not that profitable after all. So people kind of survive. And the ways they survive, especially in academia, I think that's not any surprise, is that you have, of course, a lot of funding from the state, from the government, and then reimbursement is part of it. On a different note, I will also say that I totally agree with you about the extraordinary effects. And on the note of neurosurgery, we have quite a few patients that underwent craniotomy, and we see them, and we see also dramatic improvements. These people are shocked, and so are we, to see the effect on executive functions. People can go back to work. They are successful. It's just amazing. They are in podcasts like you and I right now, and there are people listening to them, and they're able to do it. It's amazing.
No, it's incredible. And again, like I have multiple neurosurgical colleagues. I already mentioned, my colleague, Dr. Nussbaum, who's a big believer in photobiomodulation. But what I'm trying to get everybody's mind wrapped around is the fact that, for example, if you do a major tumor removal, again, I'm an orthopedic surgeon, but because I run a practice of primarily neurosurgeons, I obviously know a lot about the field of neurosurgery, and we see those patients, and we have them on our census, and so I see them every single day. A lot of times when you do these big craniotomies and resection of tumors or other things, vascular reconstructions in the brain and whatnot, there's just so much that goes on. Or TBI, you have so much loss of executive function. Now, sometimes it's temporary and it returns over the period of 6 months, 9 months, a year, or something like that. But if you think about the way that PBM works to re-energize the neuronal cells, but also is so efficient at potentially reducing inflammation around with the resection areas and things like that. If we can get people, as you say, to return to their executive function much earlier, not to mention the benefits that it can have on tracks that are affected as far as motor functions and other things. This depends on the part of the brain, obviously, that's affected. But why would we not look at utilizing, low-level light therapy on almost all patients that have craniotomies, brain tumor resections, and all these other things if there's no contraindication? And there's very little contraindication to doing low-level light therapy on these patients. In fact, my partner, Dr. Nussbaum, he has no problem, because we have treated some patients that have inoperable aneurysms. No problem. I always get consent from him. He says, no problem. There's no reason why you can't treat them with low-level light therapy. Only a small percentage penetrates the skull, and there's really no contraindication on those patients, according to him. Again, have there been tens of thousands of patients studied? No, but he's not worried about it as far as clearing, and we haven't seen anything. So I love the fact that you bring that up as far as the neurosurgical world and some of the amazing applications there may be down the road. And I think that many, at least the neurosurgeons around me, they're starting to come around to as I'm force feeding them articles and things like that, they're starting to come around to the possibilities in using low-level light therapy for neurosurgery. And an interesting thing I'd actually like to ask you about as we digress, this is how these podcasts go, though. It's a lot of digression.
I have a digression on the digression, but go ahead.
You know what? The more digression, the more interest there is in the show. Honestly, if it's boilerplate, people...
But I haven't forgotten your question, so I will answer your question.
A digression, and something that I posted on LinkedIn, and I'm going to invite the authors out of the University of Birmingham in the UK. Very interesting. As a spine surgeon, there was a publication they looked at a rat model, and they looked at using photobiomodulation in the rat spinal cord injury model, where they basically pinched the spinal cord with tweezers, created a spinal cord injury, and then saw significant recovery. And what was cool about that study was they actually developed a little probe, a little photobiomodulation probe, which they basically surgically placed next to the spinal cord. And sort of the future of spine, imagine this. Imagine a patient of mine, because we do spinal cord injury, right? A patient of mine comes in and has some sort of a spinal cord injury, a fracture dislocation, where they don't have a transection. We know in spinal cord injury, a lot of it is secondary effects, secondary inflammatory cascade. Imagine we go in, so surgically, I can go in and repair the spinal cord injury, putting screws and putting their spine back in alignment. And so the cord is no longer buckled or pinched or whatever else is going on. And then at the same time, we place a photobiomodulation stimulator right next to the cord injury. And at the same time, we utilize stem cell therapy, which has been shown now at both at Yale and at the Mayo Clinic in humans, that can improve recovery from spinal cord injury. Now, combining that, right? So you have surgical treatment, photobiomodulation, combine it with stem cell treatment. Imagine that as the standard of care of the future of spinal cord injury. When I think of things like that as a spinal surgeon, how can we not get excited about the future? Obviously, the human studies need to be done. I'm hoping to get those folks out to the Society for Brain Mapping meeting in February. But what are your thoughts on that? What do you? I digress. Have you thought about the spinal cord injury model and the use of photobiomodulation? I know that's a little bit outside of your field, but certainly something that excites me because it's. I mean, that's in my sweet spot.
Yes, we have. In fact, we're very interested in collaborating with the groups here in Mass General Hospital on ALS, and so of course, spinal is it's a big target as well as the brainstem. So it's something we're very interested. We're looking into getting something off the ground. We haven't necessarily looked at traumatic injuries for the spine, but I think it's certainly worth looking to. You know, you will have to figure out about warming, how to deal with that. But you know, I think it's doable. I think it's definitely something. You know, the implantable devices have also a higher level of clearance, and I'm sure you're familiar as a surgeon, but I think it's worth pursuing for sure.
Yeah, and you can do. I mean, certainly the reason for that now a lot. You know, in some it'd be interesting because it'd be interesting to compare in humans eventually doing a spinal cord stimulator or another way, because obviously you're going to have the scatter from the bone, right? If you have lamina still intact, it'd be interesting to see when we repair, because sometimes we don't need to necessarily do laminectomies. We just kind of put the spine back together and that way without doing a lamina. But it'd be interesting to see what the penetration would be if you do a full laminectomy over the area of the spinal cord injury, and then you just treat with whatever class of light therapy, potentially using class 4, you know, directly, or even class 1. It depends, because it's just about a depth of penetration situation over the laminectomy bed. That might be just as effective as an implantable spinal cord stimulator. But I think one of the reasons we talked about industry before, one of the reasons why, as scientists, we may need to think about the implantables is also because then industry gets a lot more interested, right? All of a sudden, they are interested because they see the potential dollars down the road. Now, again, we see the benefit to the patient. They see the dollars because from an industry standpoint, obviously putting an implantable device is going to be something they're more interested in than shining a light on the skin over a laminectomy bed where, you know, what are the, you know, they're going to say, well, what are we getting out of it? Unfortunately, that's the way the world works. And it's very unfortunate.
Because we are also trending towards a capitated system of healthcare, where either a certain facility has a certain area of service, or where a certain procedure is covered at a certain dollar amount, regardless of the length of stay. So healthcare systems have a vested interest in using technology that speeds up the recovery. But I think there is also a very compelling financial survival issue there, and they might be receptive. And the digression to the digression that I promise you is, in fact, a promise. I'm going to promise to you and to the people that listen to the podcast that today I'm going to email my CEO here in this hospital and let them know about this technology, because it might end nowhere. But at least I want to take that step.
I agree. And I think that the more people that we can just get on the radar that may have the ability to help to spark, you know, more interest, more funding, just more energy, you know, behind this movement is going to be great. So just briefly, just tell me about Harvard and how, and Massachusetts General, and how this all came about before. And then I really want to get into some of the diseases that you guys are looking at and the mechanisms of how it all works in the brain.
So, you know, in Mass General, we have had for decades now the so-called Wellman Center for Photomedicine. And we had two pioneers there, Rox Sanderson, and the other one is Mike Hamblin. And they have done incredible work. And a lot of that work has been animal models. However, thanks to their work, and of course many others, but specifically their work here in Mass General and Harvard, this has become an area of research here. The other aspect that was very important here to make this transition to neuropsychiatry and mental health is that the psychiatry department at MGH is one of the largest when it comes to not only clinical service, but also research. And the mindset in this department is very agnostic, whether there is proof or not of the efficacy. If there is a scientific rationale, people are willing to take that on and put it in a well-designed pathway of rigorous testing. And I think the combination of these two aspects, the mindset that we had in psychiatry here at Mass General, and the presence of these pioneers in the photomedicine and phototherapy led to this development.
I think it's wonderful. And I think that the fact that, I just be honest with you, as a skeptical physician myself before learning about some of this technology and work, having institutions with names such as Harvard definitely helped to spark my interest in saying, hey, they're doing this kind of work at Harvard. There must be something to it, because this wouldn't be going on so long if they didn't feel like it was a worthwhile, venture. So again, not that I'm not knocking, other much less known institutions. People do, as we know, people do great work at all of the med schools and all, anywhere. It's just people are doing great work in the private industry. People are just, doing great stuff. However, as far as having, names like Harvard behind these types of technologies, definitely makes a big impact just in trying to break through into the mindset of, oh, this stuff is just smoke and mirrors. It's not real. It's just light. How can it do anything? And so I'm very grateful for institutions such as yours for, doing this work and now really accelerating the work. And that'll be a great transition into some of the work that you guys are now doing at Mass General and looking at all types of different diseases, from the normal aging brain to cognitive dysfunction to movement disorders to psychiatric disorders. So you're a psychiatrist. Let's start with psychiatric disorders. Can you tell us a little bit about depression, generalized anxiety, PTSD, things in of that nature, and how photobiomodulation is being used and what the results that you guys are seeing?
So thank you. The first thing I will say is, as always, there's no FDA indication for any of these conditions. We use this technology off-label because the hospital has approved a clinic for the use of this technology. The reason why the hospital has prove it, and I know it might be repetitive, but I just want to say it is because there's no significant risk associated with this treatment. With one caveat here, I will say that we know very little about the long-term follow-ups. There's some case reports of people that have used this technology for years. We have used it in some outpatients for years here, and we haven't seen any problems, but that's still small numbers. That being said, it's also true that 50% of sunlight is infrared light, and 30% of sunlight at ground level, at least at the equator, is near-infrared light. So we're constantly bathing on infrared light, and we don't see a lot of bad consequences from it. Differently from UV, from high energy light, this is low energy light. So we use it in the clinic, and our clinic is still a fairly small clinic, but it's growing. And we see the benefits, specifically for cognitive aspects. So that's really striking, but also for mood. It takes a little longer for mood sometimes than cognitive benefits. But within 6 to 8 weeks, we see those benefits. Sometimes patients can be quite, pun not intended, impatient. And, some people, after a few sessions, they don't notice a change. Maybe they stop, but Unfortunately, what we see also in other treatment for depression, it does take weeks to see a change. We also conducting and have conducted clinical trials. So for instance, for depression, we are in our 5th trial, and we have seen great improvements. And sometimes we haven't seen improvements. And that really brings home the point that you have to be really careful about the dose that you're using. The same way that you wouldn't give a tiny 10 milligrams of Prozac and expect to have an extraordinary response. In very exceptional cases, yes, someone might respond, but most people won't. The same is true for this treatment. You really need to mind the dose.
A couple different things. Number one, what you said about, we always have to do that. We do that too with our patients that we see at the wellness center. Now with our wellness centers, now we're expanding into more of medical clinic model where medication management and stuff like that. But in our wellness centers, we'll do the same thing there because it's off-label use. We are very much repeating, just like you said before, kind of the insignificant risk, to them. But what I really try to stress to people that ask me about this stuff, where they are very skeptical or they're like, well, how do you know, what happens, whatever. Think about the risks and the side effect profiles of medicines that we give to people and how accepting they are, right? The latest drug comes out in depression treatment, right? And it's pushed not just to the medical providers, but also to the lay public, whatever that may be. Let's say drug X. It's so amazing how quickly the adoption can take place. If you look at some of these drugs, weight loss drugs, other things that are coming out now, think about how quickly they've been adopted. You're talking about curves they're just unbelievable growth in these things. Meanwhile, you talk about clinically insignificant things where insignificant risk, and yet there is pushback. So I want people to understand that, yes, these things are being used off label, but even things that are on label, like medications that have FDA approval, some of the side effect profiles, and this as a psychiatrist, from some of these psychiatric drugs, you mentioned one, Prozac. Everybody knows some of the major side effects of Prozac, but then you start thinking about some of these other medications, which are even more powerful, the side effect profiles, it's significant, right? And so we have to spend such a large amount of time talking to our patients about any of drugs that we give them. It's nice to have an option that, yes, maybe it won't work necessarily, but if it doesn't work, the risk of harm to them is so tiny that it is worth, using it. Now, one of the other things, now I get into the digression, going back as far as payment options, and you talk about the fact that because it's not FDA, it's not paid for. If you think about what people are willing to spend out of pocket on some traditional medical treatments where they have deductibles or other therapies out there that somehow have better marketing. People will spend a tremendous amount of money on that, but yet photobiomodulation, which is frankly very cheap, to have done, they're like, I don't want to pay for that. They just feel like in our system, everything should be paid for by insurance. And for some reason, we haven't been able to get the message out as far as how low cost these things can be, but the efficacy can be so dramatic that it is a no-brainer in some of these psychiatric conditions or neurologic disorders to at least have it as part of the treatment protocol when looking to, have a broad-based approach and try to limit medication management or invasive procedures if it gets actually to that point. Going back to the treatment of depression, you made a great point that also I want my audience to really take to heart. And that is, unlike something like concussion, where, to be honest with you, we do see some patients respond pretty quickly to photobiomodulation and concussion. It's pretty dramatic sometimes in a short period of time. But in depression, just like when you what's the first thing you tell patients if you put them on Prozac, right?
6 weeks, sometimes 4,
Yeah.
and
the list of side effects, right? Not to mention, we don't have to make that list. It's not like, hey, we're going to put this helmet on you or we're going to treat you with transcranial laser. Hey, I have to provide you with this list of 19 side effects that you may experience. Like, that's not a thing. right, with photobiomodulation, even though I'm sure there are some things like if people have, psychotic, we talk about this ad nauseum with our medical director, Dr. Sipple, about being very careful on people that have any, psychosis in their background because overstimulating the brain and things like that. So those are the types of people we do not treat under the wellness clinic model. We will do it in our medical model. Now another digression to the digression to the digressions.
I have another digression too, but you go
Awesome.
first.
No, I just a question. So I had a professor out of California, his own private practice, Dr. Kirthi Sunder, who's a massive proponent of transcranial magnetic stimulation for treating resistant depression. And that's something we are interested in looking into for our medical, center treatment of more resistant depression. What are your thoughts on utilizing the combination of that with photobiomodulation? And is there anything at your institution where you guys are thinking about doing some studies on that combination? Because I've actually talked to Dr. Sunder on doing a study on those two modalities combined.
Yes, we are. In fact, our center we're embedded in the Division of Neuropsychiatry, and it's the Division of Neuropsychiatry and Neuromodulation. So we have all this other technology, transcranial magnetic stimulation, transcranial direct current stimulation, transcranial alternating current stimulation, you name it. So we're very interested in combination. We have sent quite a few grants application to the NIH, both, for instance, in transcranial direct current stimulation and photobiomodulation, transauricular vagus nerve stimulation as well with photobiomodulation. Everything has been rejected so far. So we're persistent. We'll get back and get more. We are, however, realizing that some of our patients are waiting for TMS, eager to start treatment. And we have a clinic here. We are approved by the hospital. So our plan and practice now is becoming to offer them photobiomodulation if they want to have treatment right away and not wait so long while for the TMS. Because of course, the TMS, as you know, requires 5 days a week treatments. The clinic gets packed very easily. And so that's sometimes there's a waiting list.
You want to share your digression if I didn't knock it loose?
Yes. So my digression is that I think you embody a very powerful conversion. You were a surgeon. Every minute you spend outside the OR, you're losing money. And so you did something amazing here, kind of repurposing yourself, and not only financially, but even your status. You practice as surgeon and a neurosurgeon, your status is high here. You're in a wellness clinic down here. And so your conversion is powerful and something you should, sure you have it. The more you do it, the more you can rally people.
I appreciate the kind words. I can't tell you more. People that do listen to me, they know how excited I am about this topic. And I think as a spine surgeon, and I'm still a practicing spine surgeon, but I'm wearing two hats right now at one time. But I think one of my frustrations as a spine surgeon that loves to talk and loves all these other modalities, as a spine surgeon, I can only help X amount of people doing what I do, right? And so per week, I can do so many surgeries, I can do stuff. I feel that as somebody that has, and again, I did not do any of the bench work, the beautiful work that you guys are doing at your institution and that you are pioneering, some of the work of Dr. Hamlin and other amazing pioneers all over the wellness space that I am so in awe of. However, I believe that I'm in a unique position that I have identified the amazing work that all of you guys are doing. It's just incredible. And being somebody that loves to talk and loves to just talk to people on just a kind of a blue collar, hey, let me get this in your face kind of level, right? I think that I'm in a position that I can try to spread this message of things that need to be shouted from mountaintops. And then we can make a difference in millions of people's lives because, as you know, man, are people struggling out here. And every time I see a human being struggling, it really breaks my heart. That's just who I am. And I'm in these, and as my spine surgeon in my practice, I just sit there, seeing all of these, sick people And a lot of it's, chronic disease, mitochondrial dysfunction. I see so much brain disease, which is outside of, my world of spine, and I see them spiraling, not doing well, not getting the right treatments. And I want to help them so bad. And I feel like the best way for me to help them is to, get involved with people like yourself, try to spread your message, try to maybe do some joint studies down the road, do clinics together, whatever we can do to bring these technologies out to the mass public. My level of energy on these, topics, it's boundless. I could talk about this all day. And you're right, there is no money behind this. It's just the passion to help people.
Yeah.
And again, same thing. I mean, you're in it, so walking both worlds. But yes, I get deeper and deeper in the wellness rabbit hole. Rabbit hole is another word that my wife is. She's like, "Can you please stop saying the word rabbit hole?" But it's true. Once you get in, it's like, right, just like our digressions today, right? You get into this and you can't stop. It almost becomes an obsession because we see it clinically of the people that we see, and we're like, how in the world am I not watching? Like, for example, Sunday morning, all the talk shows, right? All the politicians are out there, and you see the doctors, and Sanjay Gupta's out there, and all these people. How are they not talking about photobiomodulation and wellness, and even like other things that I'm hugely passionate about, microbiome health, right? The work that's being done on the microbiome, it's changing the game, but yet we're still talking about the same old stuff. Right? It's just, sorry, I went on a huge
No, I actually had a confession to make, and not to be too much in the religious field of conversions and confessions. But, when you proposed me, Stefano, to come here for 90 minutes, I thought, you know what? I don't talk that much. I hope this guy talks, because what are we going to do for 90 minutes? But I'm glad you're talkative. That's good.
Oh, yeah.
All right.
No, it is funny because what I'm seeing with my guests, and we're kind of getting to the end of it, but what I'm seeing with my guests, it's been interesting. Some of the guests that have come on, they have preference, like literally, like when we have our little talk before 5-10 minutes, they're like, well, let's try to limit it to 30 or 40 minutes or maybe 60 minutes. And I'll be honest with you, sometimes, a couple times at 2 hours, I've had to start doing so because once I'm trying to get that, listen, I know the people that I'm bringing on are so passionate about their work, but sometimes just getting that passion out of them is amazing. And sometimes so much passion comes out, it's at some point I'm like, man, it's 2 hours and I have another show to do, whatever I need to do. And so sometimes I have to unfortunately just, say that, well, they thought they were going to be on for 45 minutes or an hour at the most, trying to figure out what to talk about.
Stefano, you feel free to cut any of my rambling anywhere. So
no, this is exactly what our audience needs to hear, because honestly, sitting here, we could listen, I'm a mitochondrial, like, it's an obsession. I'm obsessed with mitochondria. I even did a post with me, wearing a shirt about mitochondrial power, and it was just kind of interesting. And I know people are like, wow, he's really going off the deep end. Some of my colleagues are like, oh my God, that guy, the hardcore spine surgery guy, cannot believe where he is going with some of this stuff. It's too important. What I want to really get to, as far as some of the things that you guys have seen in the lab, is just fascinating. Again, not to get into the weeds, audience is, we don't want to, I think they're going to be very excited about what they hear here, because it's really showing two guys that are really excited about what's coming down the road with photobiomodulation. But can you talk about what you have seen in the brain? I know the frontal lobe is kind of your main target, although we don't know, right, how it's all going to fit together. But targeting that frontal lobe, can you talk about what you're seeing, improvements in cerebral blood flow, lymphatic flow, things like that, and how you believe then that helps in improving cognition? Because that's the key, right? Tying what we see on scans with what we are seeing clinically. That's how it all starts to come together. And that's how our colleagues start getting interested, saying, okay, I get it. I understand how this works.
So sure. So what we are seeing is, in a nutshell, we can modulate the oxygen level depending signal in the brain. So we can see, and this has been demonstrated by other groups in Texas as well and elsewhere, that you can increase brain oxygenation. Interestingly enough, our group has also seen that you can increase, but you can also decrease depending on the dose, or you have no effect whatsoever. And we show that decrease in oxygenation, specifically with particularly low dose of light. And this could be that we are activating the brain also with a low dose, and that leads to some consumption. Oxygenation in the low dose might not be that powerful to trigger a paired increase in blood flow, or not as large as the way you would see it with a high dose. So these are speculation, but yes, we do see a change in oxygenation, and we see that as dose dependent. Now, our brain starves for oxygen, for nutrients, and typically what you see is that that is paired, at least from a clinical standpoint, with an improvement in clinical signs, whether it is what we were discussing, the cognitive function, which in fact we have demonstrated as an improvement even in depressed subjects, and improvement in depressive symptoms. In parallel, our group and other groups have demonstrated that we can in fact modulate the firing of neurons, and we demonstrated that with electroencephalography, with EEG. So you can see that continuous wave, so continuous signal of light leads to improvement of fast brain waves. So there's more firing, and that firing happens fast. That's a sign that the neurons are active, and they're more active, and that's typically leading to improvement in cognition, at least for frontal control and frontal functions. If you use, and this is true for not just photobiomodulation, but also other techniques like electrical stimulation. If you use a intermittent signal, so what we call pulsing, you can actually pace the function of the brain to the same rhythm that you are stimulating. So you can let the brain go fast or slow. And so that's very appealing, because that can reverse what we see in many of these cognitive conditions, which is in fact a slowing of the brain's pace.
I think that's great. And I think that you are showing in some cognitive decline patients improvements in their cognition. What is really interesting to me is this concept of just taking normal aging cognitive decline and potentially being able to do something about it. So I can imagine a world where everybody just does transcranial photobiomodulation to keep their brains sharp. And so can you talk about some of the work you're doing in just normal subjects who have just, over 70, let's say, kind of types, who have normal, what would be expected frontal lobe, because they have decreases in blood flow and cognitive, it kind of all goes together. Do you see a world in the future where everybody, as we start aging, it's just part of your normal wellness protocol to treat your brain with photobiomodulation to improve your cognition? Because I know some of the studies show immediate, improvement in tasks right after having a photobiomodulation session to your brain.
I couldn't agree the more with you. It's really human to want to do brain hacking. We do it by drinking a Diet Coke, drinking a coffee in the morning, or if we're too anxious, we might take a beer at night. That's really natural. And we have our go-to snacks, whether it's chocolate, and we know what makes us feel more energetic, more focused, what is counterproductive, and we learn to adjust, and we know that we need to do a certain amount of physical activity over the week to keep up, especially if you are in a very demanding job. So that's true for surgeons, that's true for CEOs, that's true for many people, and at home dads or mothers or wherever you are. So I see that this is a natural extension. And in fact, I believe that this is going to be much more precise, because now we have devices that have sensors included. So you can run a QEEG and know exactly what to modulate in that person to offset, whether that's a little insomnia that would have trickle effects the next day. You know what to do. So, however, the adoption of that for that purpose is still at the very beginning.
Well, I can tell you that I use it myself. I do transcranial photobiomodulation, and I definitely see a difference. I know that my partner, Dr. Sipple, certainly does it. He did it way before I knew anything about transcranial photobiomodulation. And so we're not just proponents of it, but we're also users ourselves of transcranial. I don't know what your own personal,
Yes, I'm going to tell you right away, I'm using it myself. And it's too much disclosure here, but I'll say that it's nice to start your day with it and it's relaxing. I do think that it makes you sharper. And I think this is how PBM is hacking the system and find its way, because people that are proponent of it are now boosted.
Absolutely. No, I have an entire I have a protocol. I actually, maybe, I don't know, 5 or 6 months ago, I posted something about my protocol, using all these biohacks. That's the way I start my morning. I do structured water, pulsed electromagnetic frequency. I do, whole body photobiomodulation, transcranial biomodulation. I mean, that's the way I start my day. I don't know another way to start a day because it's so much more effective. And I'll still have my cup of coffee. I just love coffee. I mean, it's just something I've been doing since I was a teenager, honestly. But
that goes with being Italian.
I think, yes, we in that have discovered these technologies, you use them, again, not to use the religious terms again, but it's religiously. In fact, it's funny because our family, we went on a trip to Puerto Rico for the New Year's, and I didn't have any of my biohacks. And honestly, I don't know if it was psychosomatic or what, but I really was at like day 4, I'm like, we got to go back home. I need my stuff. Is there a red light, therapy place around here? I got to get in. And of course, there was nothing. There was nothing to be found there. But very, very
just nature.
Just nature. But I still got a lot of sunlight, so we'll take that as the really natural way to get a little bit of it.
No wonder you have so much energy. No wonder you can do all of this. It's amazing.
I tell people all the time, and I tell my colleagues, and I tell other people, with as far as biohacks that we're doing and the transcranial work, I say, you know what, do it for a month and you come in, and if you can look at me with a straight face and tell me it hasn't made a major difference in the way that you feel on a daily basis, okay, I'll be shocked. That is one of the ways that we can really promote these technologies, is having our colleagues do it themselves, because it speaks for itself. We have a number of physicians that are clients at our wellness center that do these modalities, and they were the biggest skeptics. You got to send these guys cards and flowers and all kinds of stuff to try it, to even try the stuff. Then they go there and they're like, oh, this is interesting. It's different. Next thing you know, they swear by it. I mean, it becomes their lifestyle. It's so interesting, some of the pushback, going back to what we talked about before, but just getting back to the science before we sort of, run out of time. I wish we had 3 hours on this, because, I mean, honestly, there's so much to talk about in this thing. The audience has to understand this is tip of the iceberg of the science. I mean, we could get into, utilizing, quantitative EEGs and using it to specifically target areas of the brain that are not functioning optimally. And you guys are doing that through the helmets and things you're developing, which is amazing, through Neurax and other things. It's fascinating research, because everything in the future of medicine is really precision medicine, right? It's not one size fits all anymore. It's Dr. Cassano is going to get this treatment because in the mornings he wants more energy. So we're going to figure it all out, and boom, we're going to hit him with this protocol. We'll call it the cappuccino protocol, right? And these are the types of things that get people excited. And if we can target areas of the brain, I'll tell you, one of the things that we are doing is we are actually rolling out. And again, I also like to make the caveat that a lot of this stuff isn't FDA approved, but it's extremely safe. And we're trying to rewrite the protocols on the way you do it. So one of the things, I had Dr. Blum, Kenneth Blum, on the show. He's a psychopharmacologist, world renowned, and we talked about the pleasure reward centers and addiction and pain and how it all kind of wraps in. We're adding now to our pain management protocol transcranial photobiomodulation, in trying to make differences in the perceptual aspect of pain. So now imagine, this is so interesting to me. Imagine you have knee pain, for example. You have a bad knee injury, right? So you come to one of our clinics and you want treatment. Imagine now we're going to do pulsed electromagnetic frequency to that area with some specialized devices that we have, like high intensity pulse. We're going to do all our other stuff, but you're also having class 4 laser therapy directly to that area, and that is FDA approved for that indication. But now adding transcranial photobiomodulation in trying to change the perception of pain, which again, my partner, who is a pain management specialist, Dr. Sipple, it's very, pain is a complex issue. That is a podcast. That's a 10-hour podcast. That's a webinar. We could go on all day. We can parade on all these specialists. I'm sure there's a lot of people at your institution that would love to come on to talk about pain. But as a psychiatrist, you know how important the brain is in the perception of pain. So adding that, I believe, will make a big difference into being able to overall manage people's pain and make a difference in things like the opioid crisis, which is a complete disaster in our country and other westernized nations. And so, again, I went off on a tangent, but yeah, there's so much that we really can talk about. Do you have thoughts on that?
I think that if you really want to manage pain effectively, you have to manage those central mechanisms of pain. So basically, our brain keeps perpetuating the pain sensation once they receive that signal from the periphery. And so it makes a lot of sense to tackle that with transcranial treatments. In fact, our group has just published 2 reviews on this topic, both looking at the overlap with peripheral neuropathy and psychiatric disease, and how much overlap there is, in fact, with treatment. Now, a lot of treatment and psychopharmacology for peripheral neuropathy is borrowed from psychiatric treatment. But we also look at the application of transcranial treatment, and specifically transcranial photobiomodulation, which I think would be very promising. Our group also work on fibromyalgia. And we found in some case reports that the transcranial treatment was extremely promising. And we're now collaborating on another manuscript with a group in Brazil, and they have data on photobiomodulation for fibromyalgia. So pain is a huge topic here. And of course, just stating the obvious here, but light also have pro-endorphinergic effect, which might decrease the need for those opiate medications that have so many challenges.
That's a great answer. And then you bring up fibromyalgia, you bring up other pain disorders, and talk to my patients about this. I've been interested as a spine surgeon that sees a lot of pain. A lot of people come in with a diagnosis of fibromyalgia. So I've actually been fascinated by fibromyalgia for a long time. And there is such a significant mental health component to fibromyalgia too that you cannot overlook in treating that. And I appreciate everything you said. And you got me really excited with the answer and the fact that you guys are also believers. It's a no-brainer that if we can modulate the wires in the box, because that's what this is, right? We're wires in a box. When we keep talking about AI and the way AI works, our brain works a similar way. It's just they're wires in a box, right? Large language models, our brain works very similarly. So if that's broken, so if we can trust, so think about like when we're treating pain, if you have something where, let's say you have an ankle problem, right? So if you modulate in 3 different locations, so you can imagine treating the ankle directly with stimulation, photobiomodulation, treating the spinal cord centers that deal with the ankle with photobiomodulation, because you're looking at the tracks, right? The ascending tracks, and then treating the brain itself, the center of the perceptual area where where we equate whatever that signal is telling us to experience pain. If we can target those 3 centers, that's going to give us a lot more efficacious treatments for pain. Now, on the topic of reducing pain, this is so critical, and I hope all my orthopedic colleagues and spine surgeon colleagues and neurosurgery colleagues, all these people, if we can reduce the use of opioids with the conditions that we are seeing, the benefit to society is so massive. It's hard. I can't overstate it. If I jump up and down on this table right now, it doesn't do enough I don't even know what to do, and maybe flash some stuff on the screen and startle people. I don't know how to get the word out there, but it's so important. Now, you bring up the fact of looking at reducing the use of opioids and things like that and releasing the body's natural endorphins. The University of Arizona got a big grant to look at green light therapy, which is something that I did a post on maybe a month ago, and we do some green light photobiomodulation at our clinic. Obviously, it's a very different, wavelength, but it's interesting that green light therapy significantly releases the body's own endorphins, right? It's absorbed oxyhemoglobin, hemoglobin absorbs it. That's one mechanism, but it also modulates the brain through, and it goes through the eye. It's a complicated like electrical circuit, but anyway, it releases the body's own endorphins. So they're doing a study. I think they got like $2.3 million to do a study on pain control after surgery in the veteran population, with the hypothesis being significant reduction in pain control. And they've also published, I believe, on fibromyalgia, but also on migraine headache, very positive results on the use of green photobiomodulation, which again has a totally different mechanism than near infrared. But again, we start combining these different modalities, because also green light also has an antiviral and antibacterial effect. And if you start looking at that, think about maybe treating Lyme's disease with a combination of near infrared and green light, and going after the reservoirs in different ways. It's just so fascinating to me, all these things. What do you think about green light therapy? Have you even scratched the surface of green light?
No, we haven't. I'm really curious about it, and I'll look into this. I will say that I believe you, and the reason is that in psychiatry, there's published work about nature therapy. So just being outdoor, walking in nature. And I'm thinking, yes, there's walking, there's, a lot of sensation, mindfulness. I can see many reasons why it would be helpful. Of course, sunlight, red light, and all of that, bright light. But there's an awful amount of green out there. So it might make a difference also because of that. I'm curious about looking into this.
I would have you look at the studies that have come out of University of Arizona and their recent citing. I can't wait for that study to come out. That's going to be a big deal. But I can tell you, we have a device that provides green light, and it has quickly become one of the favorites in the clinic because it stimulates so much endorphin release. We haven't done that research. That's been done elsewhere. Because of that, or at least the proposed mechanism to it, people really like it. And we have a lot of avid athletic enthusiasts that feel like when they get green, their level of performance, it's off the chart. Again, a lot of anecdotal evidence, but when people are so adamant about it and it's over and over again, right? If you see a treatment and you see it twice, you're like, that's an interesting coincidence. Then 4 or 5, I don't know. Then when you're at your 10th, 11th, 12th person and they're all saying the same stuff, just like we talked about, like concussion and transcranial photobiomodulation, eventually you've got to say, you know what, maybe there's not a randomized prospective study out there of 1,000 patients, but I can't explain it any other way than it works. I don't know what else to tell you. It just works, and people have to wrap their minds around it, and the studies will come. Before our time is up, I absolutely want to ask you about two biggies, which is Alzheimer's disease and Parkinson's disease. Obviously, very different mechanisms of action. I want to ask you about Alzheimer's disease first. What have you guys seen, or what's out there in the literature on improving functional and cognitive ability in Alzheimer's patients? And maybe talk a little bit about how we now consider Alzheimer's disease type 3 diabetes, because it's really more of it's just changed in our perception and believing that this type 3 diabetes or Alzheimer's disease, some of it maybe is even preventable with some lifestyle modifications and possibly through photobiomodulation.
There's much work being done all over the world. Data that were most striking to me were data from Korea, from a group led by Dave Kim. And he has shown that a couple of things. One is a group with mild cognitive impairment in 12 weeks of treatment modulated by quantitative EEG had striking improvement with the rigorous scales. I do not believe that that was a controlled trial, but their cognition, their performance normalized over 12 weeks, which was remarkable. Of course, this should be replicated in more rigorous setting with an adequate sham and all of that. They also followed a group with dementia patients over a year, and they found sustained benefit in this group as well. And this aligns with other work done by Anita Solmarsh, by Lou Lim in Canada, where in their case, they demonstrated more short-term benefits, and they showed also after discontinuation the rebound. So I think there is tremendous opportunity. I don't think we have the level of evidence that we need yet, but the data are really encouraging. And same for Parkinson, Anne Liebert and John Mitrofanis, both in Australia, have done amazing work. John Mitrofanis has also worked on primate models of Parkinson, where Parkinson was induced and found a reversal of Parkinson's symptoms. And it's just striking. He has these maps where you see now the monkeys moving normally, and how this is computerized track, and you can measure the movements before and after treatment. And Anne Liebert has videos of her patients and how their movement is more fluid. It's so obvious, and yet they're about to launch large clinical trials to demonstrate that in rigorous double-blind sham control fashion.
Yeah, I think I've read a lot of that work, both in Alzheimer's and in Parkinson's disease. It's hard not to get super excited on these technologies. How can you not? I had an aunt that passed from Alzheimer's disease. So unfortunately, I saw her deterioration, and it happened over the course of years. And it was one of the worst things that I remember as a child. I mean, it is really, I almost have PTSD just thinking about how much she suffered, and the people that were taking care of her really suffered because of her emotional lability and all the other things that go along with the unfortunate issues of Alzheimer's. And so if we can utilize photobiomodulation to even improve them by 20-30%, it's a technology that cannot be overlooked. And again, because of there's really clinically insignificant risk to them, it makes no sense why something like this, where we can't just take your Neurax helmets and put them on 10,000 people that have Alzheimer's disease and literally do that tomorrow, and then come back in 6 months and see how everybody's doing. Why we're not doing that, I don't know, but I would like to be one of the people that helps in gaining funding for these studies. If I have to sit outside of Bill Gates's mansion, literally, and do a sit-in, or maybe I can do a hunger strike until, until the press is like, I think he's going to die. Will you please come out and talk to this poor doctor who is risking his life just to get funding for this project? That kind of stuff. That's how important this stuff is. And I want our audience to understand that if you can, reverse the tremor in Parkinson's disease by whatever amount, without doing, deep brain stimulators and more invasive things, or, these medications that are being approved now. Don't get me wrong. Listen, not everyone. Many people are familiar with Robin Williams movies, Awakenings, and utilizing, L-DOPA for, and these patients, were completely frozen and they started moving. I think it's a great kind of example. And that came, when that came in my head, when you started talking about primates, that all of a sudden they have a tremor and then they stop. It just reminded me of the movie Awakenings. But I think that the more we, at least in the private world, combine with guys like you that are doing what you're doing, and I know that you're doing some other ventures which are very exciting. I think the more we do this, the more, after a while, the anecdotes become impossible not to listen, right? Because then if you have 10 guys saying, you know what, I'm treating a lot of people and I see this. Oh yeah, I'm seeing the same thing. Oh yeah, same thing. after a while, it's a no, right? Before we had all of these rigorous scientific trials, what were the trials? Like what people talked about in the community, right? People just started treating people one, right? That's how medicine was. That's how you went to the, to the local shaman. And a lot of those treatments work. Why? Because it's thousands of years of anecdotes put together. Then you have a treatment, right? So not everything needs millions of dollars spent on a trial when everybody knows it works, right? Especially when there's no harm, why are we not doing more of it? So again, thanks for the answer. And that was a long-winded response to your answer.
We're about to conclude here. I will say that we have no choice. At the speed medicine is moving, if we want to get a treatment in action, in adoption faster than 20 years or 30 years, then we have to follow this system. And it is frustrating when there's no funding for it.
No, absolutely. But you know what? Funding or no funding, we're going to do it because it's just too important. Again, I was completely oblivious to this. Now I see it in practice. So exciting to have had you on the program today to discuss this.
It was my pleasure.
In future programs, I'd love to have you back on, even if maybe we have more of a panel, but I want to really talk to you about NERAX and some of the work that you guys are doing from more of a trying to get this more commercialized and out there in the market, some of the things you found. Obviously, that's kind of a different flavor than the show we did today.
Thank you. Thank you. I'll say it out here, I'm not supposed to talk about NERAX because of all the conflict of interest policies, but we'll see. We'll see. If anything can be worked out, I'm happy to do so.
And that's why, again, I said it's out of the scope, and we'll pick your brain when we can pick your brain, so to speak. I understand some of the things, but I'm glad you're doing that work behind the scenes, and it's very, very exciting. So I would say, in conclusion, it's been a tour de force of photobiomodulation. I will say that I think that the general public is going to love hearing everything that you had to say, but I think that the fact that your position at that institution and what you guys have been able to show with hardcore data, hardcore science, and the way that you discuss this on the show today, I cannot think if I can get physicians to really watch the program again, or maybe I have to just kind of handcuff them down to a chair and say, you're watching this 2-hour show.
It's too long.
It's long, I know, but if I handcuff them, maybe they can't go anywhere. Now, I might have some legal consequences to deal with after that, but I'll deal with them. These are friends of mine, so they'll be okay. I think they'll take it all in good faith. But anyway, if I can get people to really watch you and how you describe the latest advancements and developments and everything that's going on, it's hard for, as a physician, for them not to at least be intrigued and say, you know what, I'm going to I got to open some books. I have to read all these modulation books. I'm going to go and look at all of Cassano's, all his research, and see if there's anything really behind all the things he talked about today on the show. So again, thanks so much for coming on the program. Last thing, a little housekeeping. How can people find you if they want to just learn more about what you're doing at Massachusetts General Hospital, how they can interact with you on social media, websites, whatever? You just tell me what's the best way to find you, and we'll make sure that's up on the screen and when we release the show so people can get to you.
Sure. I can give you all our social media, and my email is P like Paolo, and then Cassano, my last name, and at mgh.harvard.edu.
Okay, wonderful. So we'll put all that up there, and I encourage people to follow you through all your social media sites, especially LinkedIn. My go-to is where we tend to find a lot more physicians and things like that on looking for more hardcore data and information and trying to sift through what's real and what's not. And so, on that note, thank you so much for spending so much of your time. Some of the extra time was probably unexpected by you, as you mentioned before, but well worth it. Can't wait to collaborate with you, talk to you more in the future about everything photobiomodulation and well beyond that in the biohacking world, which is growing so rapidly. And on that note, thank you so much for being on the program and on this episode of Wellness at the Speed of Light.
Thank you, Stefano. I just want to say that what you're doing is important and you're a role model. Thank you.
Could not appreciate more the kind words. Thanks everybody for watching this episode, and we'll see you next time for another episode of Wellness at the Speed of Light.